to get the epidural or not to get the epidural. As a birth doula, I can say with confidence there is no one-size-fits-all answer to this really important question. In this video, I teach you the benefits, risks, and alternatives to the epidural. And if you choose to get an epidural, I'll teach you some tips on how to avoid a C-section. If you're new here, I'm Kelly, and on this channel, I post weekly birth tips to help you feel empowered and ready for your birth. Let's dive in. One of the most common myths that people have about birth doulas is that we're against epidurals and only think birth should be unmedicated. Well, that might be the case for some doulas, but for myself, I believe that there are many reasons to get an epidural and many reasons not to. The only thing I care about is that you've made an informed decision about your choice. And by informed, it means, do you know all the benefits, all the risks, and have access to all the alternatives to each and every decision? So let's break it down for what that means for the epidural. Before I dive in, I want to share that I get all of my evidence-based information from evidencebasedbirth.com. All right, so let's dive in. What is an epidural? The epidural is a procedure where you inject medication around the spinal nerves, the epidural space. The goal of an epidural is to provide relief from pain. The most common epidurals in labor and delivery are given through a catheter. This way, your medical provider can administer ongoing medication through this catheter. Your doctor doesn't administer the epidural. The epidural is given to you by the anesthesiologist. And if you consent to an epidural, it's likely that almost everyone will be asked to leave the room besides the anesthesiologist, yourself, your nurse, and maybe one support person, but definitely not two. Now, when you go to request the epidural, it's not something that can happen right away. There's a delay between requesting for one and actually getting one and for the medication to take effect. Before an epidural can be placed, your providers will give you an IV that will help with low blood pressure, which is one of the side effects to epidurals. There's also usually only one anesthesiologist at any given time at a hospital, so sometimes you have to wait for your turn. When the anesthesiologist arrives, you will sit over the edge of the bed and have to curl over your belly and stay super still while they insert the injection and then the catheter. This can be one of the trickiest parts because you're probably contracting pretty regularly and it can be tough to stay still. The anesthesiologist will first give you a local injection, which will numb the area, before then inserting the catheter into the spinal nerve area. After the procedure, you will lay on your back for about 20 minutes because we want to see an even distribution of the medication on your right and left side. The benefits of an epidural is that it provides temporary pain relief without altering your state of consciousness. So you're completely with it. It's not like IV pain medication where you're not really present like a drug. It's a pain relief mechanism which essentially blocks any pain receptors from the bra line below. Another benefit is the epidural can help you relax. And if you've relaxed, you're probably not holding as much tension in your body. And the more relaxed you are, the more efficiently you might be able to dilate. An epidural can also help you rest. If you've been in labor for days or many hours and haven't slept or ate much, the epidural can give you a chance to take a well-deserved rest and finish dilation. This rest might be the exact thing needed to regain energy for the pushing stage. If you decide to consent to an epidural, make sure to stay to the end of this video where I give you tips on how to make your epidural effective and not have it stall out labor and lead to a C-section. So stay tuned. There are risks to the epidural. The epidural can lower your blood pressure. It can also cause a severe headache. Now, this only happens in about 1% of people, or 1 in 100 people who get an epidural, but these headaches are persistent and very painful and typically take a while to go away. The other risk to an epidural is that it reduces mobility. Once you get an epidural, you are confined to the bed. You cannot stand up or move around to work with your body and your baby to keep labor progressing. It can often slow down labor as well and make contractions not come on as frequently. And because you're not moving, the baby isn't moving as much, and it's the baby's movement that actually puts pressure on the cervix to dilate. And so oftentimes when you consent to an epidural, you might also need some Pitocin to keep labor going. Pitocin brings on contractions more strongly. There are risks to Pitocin, which I'll make another video about another time, but not all babies tolerate Pitocin and can lead to an emergency C-section. An epidural can also cause the shakes, and this can be not dangerous, but very uncomfortable and unpleasant for the person. Epidurals can also cause a fever. If you get an epidural, you might need a catheter as well to be able to release urine, especially if you've been on the epidural for a long time, because you can't get up to go to the bathroom. And sometimes there are problems after the birth, if you've had an epidural, with being able to release urine after getting a catheter on your own, and can lead to longer hospital stays. Because an epidural stops you from feeling the strong sensations of labor, it can also interrupt the mind-body connection, which can be really useful for labor, especially when it comes to the pushing stage. This is why patients who consent to an epidural have higher rates of vacuum or forceps extraction during the pushing stage. These interventions can lead to more severe tears. If you're getting an epidural, you and your baby have to be more closely monitored. So if you haven't already had continuous fetal monitoring, you will need it if you have an epidural. The epidural medication can cross the placenta, and research does show that it can impact the breast milk, and this medication can be found in breast milk. It can delay the onset of breast milk, and it can also impact your baby's natural sucking reflexes. So there is evidence to show that if you get an epidural, there might be some more challenges when it comes to breastfeeding, and you might need to be much more proactive about establishing a good breastfeeding relationship early on. There are alternatives to getting the epidural. The unmedicated alternative is natural comfort measures and coping techniques. So things like using your breath or mindfulness, birth affirmations, asking a support team to come and put counter pressure on your hips and back, movement, water, aromatherapy, acupuncture. Essentially all the things a birth doula is trained to do. Some alternatives to an epidural that are medicated are opioid pain relief medications, which are delivered through an IV. Some states allow birthing people to use nitrous oxide, which is laughing gas, during birth to help take the edge off during contractions. All right. Now you are informed on epidurals, and if you decide to get one, whether it's ahead of time, you know you're going to get an epidural, or maybe you make a change in your birth and decide, okay, I'm going to get the epidural for one reason or another, I want you to have some tips on how to make sure that epidural is successful and doesn't lead to a cesarean birth. First tip, make sure to keep moving. Just because you're in bed doesn't mean that you can't move. Most hospitals have what's called a peanut ball, and a peanut ball can be used in tons of different ways, especially during an epidural, to help keep your pelvis opening and baby able to rotate and descend efficiently, even when confined to the bed. Move every 30 minutes, change positions every 30 minutes. Another tip is allow yourself to rest if you get the epidural. Even though sleep might not be totally possible, this might be the chance to regain the energy that you need for the pushing stage. So between changing postures, try to get some rest and just reduce stimuli, turn down the light, put on relaxing music, and let yourself regain some energy. You can tell the anesthesiologist that you'd like to request a low dose of medication. Explain that it's really important to you to have more of a mind-body connection during the pushing stage. And so depending on the timing of when you get the epidural, it may make sense to ask for a low dosage, which will help when you want to regain some strength in your legs to be able to use multiple positions for pushing. And lastly, probably my biggest tip about the epidural is if before getting the epidural, you can check where your baby is positioned in your uterus. And your nurse, midwife, or OB should be able to help you determine fetal positioning. If your baby is not in a good position before getting the epidural, it's going to be that much harder for your baby to rotate to the optimal fetal position and be able to birth vaginally. Because once the epidural is placed, labor slows down. You can't move as much. It's harder to get baby over to optimal fetal position. If you want to learn more about optimal fetal positioning, definitely like and subscribe to my channel because I'm coming out soon with videos all about that. So whatever you decide, yes epidural, no epidural, make sure you include your preference on your birth plan. And if you need some support getting started in your birth plan, I have a free template that you can download and customize to your own through Canva. I've linked it in the description below, so click it and get the template. It comes with a checklist that walks you through all the decisions that you will have to make for every stage of labor. Hope you enjoyed.